Good evening and welcome everyone. I am Dr. Komal Lalwani and I welcome all of you on behalf of Nationwide Quality of Care Network to today's Community of Practice session. So the session is all about how to remain healthy for healthcare workers by Dr. Dinesh Baswal. So now moving forward, I would like to call upon Professor Sushil Srivastava, who is the professor at Division of Neonatology, Department of Pediatrics, University College of Medical Sciences and Guru Tegh Bahadur Hospital, Delhi. He is the advisor for Nationwide Quality of Care Network and also member for National Mentoring Group by NQCN. He is national trainer for IMNCI, FPNC, ENCCC, Developmentally Supportive Care, NEST, POKI, and Neonatal Advanced Life Support. I request you to, sir, to please welcome our today's speaker, Dr. Dinesh Baswal.
Thank you, Komal. Good evening, everyone. And it gives me immense pleasure to welcome the speaker for today, Dr. Dinesh Baswal. Dr. Dinesh Baswal has been both a mentor and guide for all of us at NQCN, and he has been a stalwart in the field of public health. I'm very pleased to introduce Dr. Dinesh Baswal, the lead MNCH to PATH. He's ex-Joint Commissioner, Maternal Health, Ministry of Health and Family Welfare. He has vast 34 years of health experience, including 14 years in public health and maternal health. He has been a pioneer in maternal health and helmed various historic national level programs such as ASHA, PMSA, Lakshya, quality improvement initiatives, and midwife and provided end-to-end solution. Delivered various health KPIs such as maternal mortality ratio with decrease in 178 to 1 lakh per 1 lakh population to 97 per lakh live births. So extensive phenomena reflecting the achievements of our public health, especially in the maternal and neonatal division. He has sanctioned more than 600 maternal and child health wings, established 232 mini skills labs in A&M, GNM schools, 104 state skill labs, sanctioned more than 259 high dependency units and obstetrics, as well as ICUs, more than 2,444 facilities state certified and national level certification under Lakshya. Indeed, a tremendous and an exemplary performance. And also he has represented India in various international forums, co-authored research publications in prestigious journals like BMJ, PLOS, Global Health, Science and Practice, etc. So today we have requested Dr. Dinesh Baswal to he's a man beyond we can't describe his achievements in maternal newborn health. He has led the battle in maternal newborn health right from the front. But today we have requested him one of a unique topic, a topic which is many times often neglected by health workers, health professionals, and administrators alike. We have requested him to share his experience and his insights in how to, for the healthcare, how to remain healthy. And yes, the pressures are increasing post-COVID, and during COVID also, we have found health professionals facing a lot of challenges. It's not that the challenges were not earlier, but they have really brought the things to the fore. So without delaying further or without further ado, I will request Dr. Dinesh Baswal to please give his insights and suggestions as to how to go about and how to remain healthy in the today's challenging environment. Dr. Dinesh Baswal, the floor is all yours, sir.
Thank you, Dr. Sushil, Komal, for those kind words. Before I start my formal presentation, I would like to tell you my story. I was thinking that I am eating healthy, and I did on voluntary, didn't take sugar and other things. But, there was something missing, which I, basically could not understand what it is that, I used to feel that, irritable sometimes and, not feeling well. And so I, in last 4 or 5 years, I was reading basically various literature on how to remain healthy and what we should eat so that we remain healthy. And I came across one cardiologist who is in US who had number of patents and, by the name of Stephen Gundry. And later on, of course, I read his books, which is one book he came with, Diet Evolution, Plant Paradox. and longevity paradox, and also other books like Alexander Junger, who was also a cardiologist, who has written a book on Clean 7. The other book which I am still reading is on the great cholesterol myth. So all these books which I read, and then subsequently when I in December I got my this comprehensive health checkup, I came to know that I am having hypertension. Also, hypertension, and HbA1c was 5.8, which said that you are pre-diabetic. So I was little worried that why is it that I have a hypertension, and also because I used to do 1 hour of close to half an hour of meditation and other exercises. So, but when I went and read about Gundry, he also was a cardiologist, and he was overweight, he had insulin resistance, and he used to do gymming for 1 hour daily. But still, he could not find, and this is how the story. And then he started, he has stopped now surgeries. He is now on the wellness clinic, which he runs basically. So I think this presentation will, give a good insight that doctors also don't tell you. Like, for example, nobody told me about that this is primarily because of the insulin resistance. You are having blood pressure. And in my subsequent slides, you will find that, why insulin resistance is so important, to know that it has huge implication on your body. So I will request, Komal to please start the slide. So, the outline of my slides, I wanted to have an introduction, then what does the data say, and various myths what we have, what is the role of diet, why we need fasting, insulin resistance or hyperinsulinemia and pre-diabetic, why it is important, and how do we can distress ourselves, de-stress ourselves. Cold shower and its impact on health. You will be surprised to know that cold shower, if you take, it's has tremendous benefit. Even you can look at the various videos which are there about this, and what supplements needs to be taken so that you are healthy. Next. So there are three pillars of if you want to maintain your health. One is major component is about the diet, and of course fasting, and of course the relaxation exercise to de-stress ourselves. Somebody coined the word by the name of, it is an acronym by the name of EASE, that if you elaborate it: eating, positive attitude, spirituality, and exercise. Next. So, the issue is about, health workers. This is the US data that, health, a lot of people basically are obese. And, 9 out of 10 workers, they were admitted during the COVID time, depending on their, and they have a very, the lifestyle is not good. So basically, Komal, the slides are getting cut. I think there is some issue there. So, okay, right, fine. No, it is okay. So around 75% of the health workers are obese, and according to the data, 9 out of 10 workers are admitted in the hospital during the COVID time. And, it's a very peculiar data that 80% of your health depends on your lifestyle. And of course, the major culprit which we are having is sugar, which is the #1 dietary contributor to heart disease. And also, it contributes to inflammation. And it is the missing link between, among the diabetes and obesity and heart disease. Next. High levels dries up hormone insulin, which actually raises our blood pressure and increases cholesterol. Sugar and processed carbs raises triglycerides, which are an important and independent risk factors for heart disease. When sugar in the bloodstream sticks, happens? If there is a sugar in the bloodstream sticks to the protein, and it creates damaging and toxic molecules called the advanced glycation end products. This same process also damages LDL, contributing to inflammation and ultimately leading to heart disease. Next. So this is basically, very interesting findings which I read, that, what is our body made of? So 90% of our body is made of bacteria, viruses, fungi, and worms. And why, also COVID when happened, we were, very afraid of the virus, coronavirus, and we were, doing this sanitizing business. But, here it is that, the data says 90% we are made of bacteria, virus, fungi, and worms. And 99% of our genes are non-human and similar to chimps and gorillas. And bacteria and viruses actually make us different. So the bacteria manipulates the brain and control our behavior. And, our earlier, ancestors and earlier, our grandfather and, grandmother used to say that all disease start from the gut. And now the Western also people have started saying the same thing, that all disease start from the gut. If your gut is healthy, you are taken care of. The calories matter, but hormones matter more, because when you eat and other things, the hormones also gets influenced because of that, and that actually creates a problem. So, and one of the finding which I am sharing with you is, recently I got that what is the hours of sleep which is required for rejuvenating the body. And this is one data that it takes we need to sleep around 7.5 hours of sleep, which makes you rejuvenated and active. The other is that it's a very important finding, which is very seldom actually, because we eat and we don't keep a track of it. What is the amount of fiber should be there in our diet? And it is very, very basically these figures like 25 to 38 grams of fiber is needed per day. And majority of our diet is insufficient. Next. Earlier you say, and Gundry also mentions in diet evolution that we were hunter gatherers, we used to eat leaves and other things. So we, at the moment, I think we are eating too much, because the food is very much easily available. So actually that is causing, a lot of concern. Of course, your gut is getting even antibiotics, they actually disturb our gut bacteria. And, it takes time to repopulate your gut bacteria with good bacteria. And this is another thing which is very, very important, that fasting is key to longevity and vitality. So earlier I used to feel that, fasting is not my cup of tea. That I can't do the fasting, but I have been doing it from 9th January now, and close to you can say that it's already more than close to 6 weeks, and immense benefit. Let me tell you, there's a lot of, you feel very calm and very, very sorted. And the other thing which I found out studying the various literature is that wheat is detrimental to health. We actually started this, the green revolution had come and other things. But earlier, if you look at, and I was seeing that 1 or 2 days back, and also today in the Times of India and also in other papers, this millet is being basically a lot of talk on the millet, and also about the probiotics. So the wheat is actually, and I will in subsequent tell you that, how wheat is creating a problem for us. Of course, we seldom, and, a lot of people say that breakfast is very essential, but, breakfast is least important. Many cultures never ate breakfast. Also, This breakfast came from industrial revolution. When industrial revolution happened, people used to go and go from morning, and they used to come in evening, and that's how this breakfast business started. And this is very, very important, which is why we will be talking about insulin resistance. That 70% of the people with high blood pressure have insulin resistance. This is a very startling figure which we have, which I came across. Next. The other thing which I found out is that many times people say eat small meals and other things, but you will have to understand that whenever you eat, there will be spike in insulin. So in the business of eating many small meals is totally out of, and one should not indulge in that. And the other is that the which because of our busy schedule and other things, we hardly keep a track that we need to take the food 3 hours before you sleep. Because what happens is that when you are sleeping, in the first hour itself, the brain starts actually sending start basically washing, in the sense that it starts throwing toxins from the brain, and in the first hour of the sleep. So if you sleep before that, what happens is, and you have just taken a meal and you sleep, the 30% of your blood supply goes to the digestive system. So there is a sort of ischemia to the brain doesn't get the proper supply. Of course, calculating your ratio of triglycerides. Now, one of the things which we have to understand is that we have to be, that cholesterol cannot be one of the parameters to be taken for, starting a lot of drugs which people seldom take. So calculating your ratio of triglycerides to HDL cholesterol is a much better way to predict heart disease than by just assessing the cholesterol levels. The three major cause of aging, which I found out about reading, is that one is oxidation, which happens, another is inflammation, and third is sugar. Next. Now, what is the role of diet? How to maintain your gut health? So earlier also people used to say that कि आप bitter चीजें खाइए, वो basically detox करती है body को, and all those, and it is now being proven that dark bitter green vegetables are healthiest. They have polyphenols and potent anti-aging factors in them. And also, if you keep eating greens and the vegetables and other things, you will have a lean and thin body. So eat vegetables which have high polyphenols and liked by your gut and your gut buddies. If you eat green vegetable, you will be lean and thin, right? Other vegetables which I have found out to be very good are cruciferous vegetables like cauliflower, cabbage, etc. Of course, okra, which is bhindi, is also very good. Mushroom, and of course nuts like walnut and pistachios. Now there is also basically this one study being conducted by Harvard, that what is our diet, and they have found out that around, I think, 17% or 20% can afford the healthier diet in India. They are doing this, and initial results had come on, and I happened to be there in that one webinar where they were sharing this finding. Next. Eat food which so this has been we eat food which maintain your gut health. Eat diet which has probiotics and prebiotics. Now probiotics are food which are have good bacteria and card and other things, and kefir, and prebiotics is like green onions and other things. Now, vegetable oils and sugar are the two inflammatory, and sickness promoting products. So you have to be, careful in and keep away from that. Diets that are lower in sugar and are basically and processed carbs will reduce inflammation and blood sugar of course, and insulin also, insulin resistance and triglycerides. Lowering your triglyceride automatically improves the ratio of triglycerides to the HDL, which we had discussed earlier. Next. Now I mentioned about why wheat is detrimental. So, there's a lot of talk about millets now, and, uh, sorghum is the healthiest, you can include in your, diet. Because these detrimental, why wheat is detrimental, I found out in one of the, you can also read the book Plant Paradox. It is actually given in that whole list of, it contains toxic called as wheat germ agglutinin. So in wheat, you have a wheat germ agglutinin is there. It can pass through the walls of, intestine more easily. It behaves like insulin disrupting normal endocrinal functions by pumping sugar into fat cells, where the sugar turns to fat, resulting in weight gain and development of insulin resistance. Block sugar from getting into muscle cells, creating still more body fat and starving muscles of nourishment. Interferes with the digestion of protein. Promotes inflammation of by releasing free radicals, which can thin the mucosal lining of the gut. Cross reacts with other proteins, creating antibodies that can induce autoimmune responses. Crosses the blood-brain barrier, taking with it other substances to which it has bonded and causing neurological problems. Kills cells without distinguishing between normal and cancer cells. Causes atherosclerosis, hardening of arteries, form a buildup of the plaque, and contributes to the development of nephritis or kidney inflammation. Next. So, having said that, because I didn't knew, so I was also eating wheat, and maybe now close to 6 months or 7 months that I have come to know that I have switched over to now sorghum, which is a better better way of instead of wheat, which is has so much of detrimental to our health. Why we need fasting? So the fasting is very important. That actually, and I knew very long that if you allow your body to heal, it heals. But provided you allow the body to heal. So there are various type of fasting, but I will speak only about the intermittent fasting, which is also called as time control eating or eat pause eat. Also, some people call it. And basically, what happens is that when you increase your increase your time when you ate last time, there is a dramatic difference in your health. And if you increase the pause time to 16 to 18 hours, the mitochondria repair happens, because otherwise, if you keep eating, the mitochondria is on the job. They are converting whatever you are eating, sugar, into the energy. And because of this, there is a lot of damage to the mitochondria. But when you do fasting, the mitochondria not only repairs, but it also actually multiply. So this is the benefit of fasting. Next. Now, this is the data of again of how basically insulin resistance. As I said that insulin resistance is a problem, and basically insulin resistance actually is basically in hyperinsulinemia. So 50% of the normal weight individuals are insulin resistance. This is a US data. 88% of the overweight individuals are insulin resistance, and 99.5% obese individuals are insulin resistance. So sensitivity to insulin actually also, if you age, your sensitivity to insulin actually decreases as you get older. In India, since we are having this cereal-based diet, we are either consuming rice and also, either wheat. So both actually causes insulin resistance. Next. So, insulin resistance actually is a reduced response to the hormone insulin. How do we detect insulin resistance? In the simplest way, you can, basically stand before the wall, and if your, tummy touches the wall before, body, that means there's a time that you need to check your insulin. Fasting insulin is a very good, test which you can do. If your waistline is more than 40 inches for men, and if your waistline is 35 inches more for females, then you must go for the testing. Now, what is insulin resistance? So that means you are taking too many carbs that you can metabolize, and people call it by another name, that you are metabolically inflexible. So there is a elevated levels of insulin is there. Next. And if you have any of these, then also, you need to go for the test. If you have any of these conditions, then you may having insulin resistance. Do you have more fat around your belly than you would like? Do you have high blood pressure? As I mentioned, that
I think there is some internet connection issue from Dr. Dinesh Baswal's side. Sir, are you able to hear us?
I'm able to hear.
So you can continue.
Komal?
Yes, sir. We are able to hear you.
Okay. So, as I mentioned that, 70% of people who have high blood pressure has also, insulin resistance. So, y- do you have a family history of heart disease? Do you have high levels of blood triglycerides? Then please go for testing. Do you retain water easily? And do you have family member with insulin resistance or type 2 diabetes mellitus? In all these cases, you must go and, check for fasting insulin. Next. Uh, Now, what does insulin resistance do to your body actually? So, the insulin is a very powerful hormone. So, basically, is in when you are insulin sensitive, it is anti-inflammatory. But it is highly inflammatory when it is when insulin resistance develops. So, it's a very powerful hormone, and you can imagine that if I say in other terms that it needs around 5 other hormones which actually wants to balance the effect of insulin, like growth hormone, glucagon, cortisol, adrenaline, non-adrenaline. Also, it has been incriminated in chaos. That means it's a acronym which coronary artery disease, hypertension, adult onset diabetes, obesity, and stroke. Next. So how do we manage and how do we address it without drugs? So one of the way to reverse it is by doing intermittent fasting. So as I said that you need to do fasting for 14 to 16 hours. And when you do that, you give a rest to your mitochondria, which also the mitochondria, and your digestion is proper, the insulin levels goes down. So also you need to eat complex carbohydrates, reduce carbs, increase protein and fat in your diet. When you increase protein, there is a slight amount of insulin, there is a spike. But when you eat fat, there is no increase in insulin, because fat, you don't require insulin. So, fat is healthy, which you can always take. Initially, it will, when when a person when a person is insulin sensitive and he does a fasting, he doesn't have a problem for doing for 14 or 16 hours. There is no craving. But a person who has insulin resistance, he will have a serious problem, because what happens is that they find very very difficult to do fasting. Reason being that there is a lot of what happens is that when you fast in an insulin sensitive, the sugar is you are not eating any sugar, there is no sugar there, so your fat needs to be mobilized, and the fat gets into fatty acids, and ketones are broken down. Fatty acids is broken down into ketones, and then you get that energy. But in this case of insulin resistance, so you get your the it's our body does not metabolize. That's why we call insulin resistance at metabolic inflexible. So for avoiding this and doing this, what you can do is that every week you can increase for 1 hour fasting. Maybe, like for example, when you wake up and take breakfast at 8, you switch over, increase the time limit to 9 o'clock you should take in the first week, and 1 day off, maybe Sunday you can take your normal meals. The next week you should increase another week. So this is how you increase to 14 to 16 hours. And of course there will be problem. So and I also myself, I can share that it's really really very challenging when you do this, and you have a huge amount of craving to eat food. And so one of the thing which people have recommended is that either take walnut or pistachio. These nuts are good. Also, you can take a teaspoon of medium chain triglyceride, which is called as MCT oil. It's MCT oil is nothing but derivative of coconut oil. So that when you take 1 tablespoonful, it actually metabolizes into ketones, and the energy is actually provided to the brain. Next. The intermittent fasting needs to be continued actually, because you have to continue it for at least a month, and then, and also if you are able to do it, then you do it for 2 to 3 months. These insulin resistance settles, and you can check from your blood sample for fasting insulin. If you go and get it yourself checked in the laboratory, the fasting insulin, if it is within the normal limits, then you can go and do a maintenance. That means in a week, you do an intermittent fasting twice a week. That means in 2 times in a week you do, and rest of the days you can eat your normal food, normal meals. Next. So coming to the other part, which is very, very important, I have talked in detail about the, insulin resistance. And basically, so how do we de-stress ourselves? So, there are a lot of things that one can do. One is that if you want to, lose your weight, you need to walk after meals. That's 20 to 30 minutes. If you want to increase your weight, I think the best is to, walk before the meals. And having, as I said, that the ease part, which is an acronym, so you need to have a positive attitude towards life. And of course, you can do meditation, and yoga and Tai Chi and others are also available to, go for to de-stress ourselves, because our health workers are in, quite stressed. So they need this, which is very, very important, and they need to select whichever from these which I have mentioned. And there are other products also available, and other methods are also available, which they can take, and depending on your liking, you can continue. Next. Now, this is a very, very important slide, actually, because many times people think that supplements are not needed and other things. But what I have found out that supplements are very, very important for your health. And so one of the things which you have to be very careful, as I mentioned earlier in my slides, that you should eat 3 hours before you sleep. Also, take proper 7.5 hours sleep. And of course, which is very, very important, and people, which I have read so many books, but then all of them actually say that sleep, if you don't sleep, then your all biochemical parameters go haywire. So sleeping is adequate sleep is very, very important. Having said that, of course, it's very, very important to take these supplements, which is, one of them is omega-3 fatty acids. Another is, extra virgin olive oil. You can take, extra virgin olive oil, you can put in your salad. Also, you can take a tablespoon of or 1 or 2 tablespoon of extra virgin cold pressed olive oil. It's excellent. Let me tell you, it's basically, it's the people have said that that it is a medicinal oil, so one should keep taking it. Vitamin D is the other one, and I know that there is a lot of controversy, or you can say a lot of other you can say people have different opinions on vitamin D, but actually vitamin D is very, very important for immunity. And I have myself been taking, and I am keeping my vitamin D level to 90 plus. So and I feel lot very, very good. So vitamin D actually, basically, if you see that, and if you talk to people and to doctors, they say, "Arey, aap log itna zyada kyun le rahe hain, isko band karo." But the you will find yourself a difference, huge difference, because vitamin D is, we are all vitamin D deficient, and we have to also understand that it is a hormones, and it is actually activates differentiation of stem cells, repopulate gut wall, and there's a huge amount of for immunity purpose also. And as you must be knowing that during the COVID time, people were said to a lot of literature was available on that, and people were asked to take vitamin D. And I take 5,000 international unit. If you see Gundry's these videos, he himself takes 10,000 international unit. And there is no, people say toxicity is there, but I don't think so. In his practice itself, maybe 20-25 years, he has held, not even one case he has said that there is a toxicity of vitamin D. Next. Now this is going to be my last slide actually, and this is very, very interesting. But there is a lot of videos which are available, and I have been taking cold showers for the last 2 years, and in extreme cold also, if you take cold shower, because it's one activity. There is a book by Susanna Solberg, which is, she's a Danish, and earlier she was in Sri Lanka and now settled in Denmark. She has written a book, Winter Swimming. And if you see, there is also a video available, and there is an interview of ours by Dr. Chatterjee. If you go and listen to that, it has huge, one activity which you can do is cold shower, and you have effect on NCDs, on anxiety, in depression, pain, and increase in insulin sensitivity and whatnot. It's a huge benefit. So one of the most important, I will say that one should go ahead and take this cold shower. Thank you very much.
Dr. Sushil, we are not able to hear you. Sir, you are not audible. Thank you so much, Dr. Dinesh, for such a wonderful presentation and sharing your experiences with us. So now I would request Dr. Vikram to share his comments.
Thank you so much, Dr. Dinesh Baswal, sir. That was in fact a very enlightening session, I should say. And my family also joined me in listening to this and getting enlightened on the topic. We look forward to improving the message of good health amongst the healthcare workers. I think that's of prime importance. And most important aspect is that our own physical health is also inextricably linked to our mental health, sir. And the mental health and the physical health are both linked to patient safety, reduction of medication errors, and delivering high quality of care. Any comments on that, sir, before we take it over to Sushil and open for question answer session, sir?
No, it is absolutely, you are right, Dr. Vikram, that, it is intricately linked. So this is why I am saying that, मैं जब सोचता था, मैं fasting नहीं कर सकता हूँ. मैंने कहा सब कुछ करा लो, वो fasting नहीं हो पाएगी. So what, when you do that, it's a huge change. I think your not only physical health, it has an effect on your mental health also. So I think I will seriously recommend that everybody should do, because our health workers are quite taxed given the amount of workload they have, and and if you ask me, I think as I said, cold shower is very, very good. When you do take a cold shower, this is the first, stress you can give to your body, and, wide ramification.
So, over to you, Sushil, I think, for taking this forward.
Yeah,
Thank
am
you,
I
sir.
audible? Am I audible?
Yes, sir, you're audible.
Okay. Sorry for the technical bit, sir. An excellent talk, sir. Definitely. In fact, many of the insightful, you can say, evidence which you presented must have started provoking the thinking of our healthcare professionals and workers. So there is a very, you can say, challenging problem that because of our work schedule, and not only for doctors, even I see students too, the frequent eating or you can say breakfast. What do you suggest? How should they go about starting their day?
Now, your voice, Dr. Sushil, I have missed some part of it.
So okay, no problem, sir. The
Now it's
question
clear, sir.
was, the question was that quite often we see that it is not only with medical students, for that matter, many health professionals, doctors, even nurses for that matter, have to grab a quick breakfast or a quick lunch and then proceed with their work. I know it's too much for an asking, but any insight as to how they could do a sort of a 2 meal or perhaps 1 meal a day, or maybe skip that or plan a breakfast? Is there any suggestions on that regard?
So this is a very interesting question you have asked, and very practical one. But I will say that Gundry has switched over to only one meal. Okay, so that's one. The second is that what you can do is that take olive oil mixed with salad. You can quickly take that salad. That will be good. I think if you can, if you don't, and also in the process, what happens is that when you are eating hurriedly, you might eat junk food also.
Yeah, so that's the challenge.
So that's another thing which you have to be very careful, and basically eat the greens which are important, like we have in plenty, this Karela which comes right from and 12 months it is available. So if you can just do that, take palak and all those with that, and that's fair enough, because just keeping it to the minimum and with also salad, that's the way to go ahead, because otherwise when you will be neither energetic, and you will be always fatigued, let me tell you.
So right, sir. I think very practical suggestions, and the problem challenge is, I think it's all in the mindset, because honestly speaking, as you shared with me, most of the doctors, and in fact me for that in particular, we think that as a doctor we may not be having these challenges. We are eating very healthy. We are very conscious about what we are eating, but the evidences which were put today, in fact, forces us to relook and go back to the books. In fact, what we have been taught, for that matter, especially for vitamin D levels. I think these are very important insights, and yes, the research goes on. So I will now request Dr. Komal. Dr. Komal, do we have some questions? Because
Sushil, I think just one short thing I would like to ask Dr. Baswal before we take the question. I think I'll take that privilege. So, sir, you just mentioned initially that there's a myth of cholesterol.
Yes.
So I just wanted to know, you just been telling all through the session, and I know even we've all been reading about it, that it is the main culprit for most of the maladies the populations are facing today has been sugar, and the carbonated drinks, and the high content of sugar in all the food stuffs with the small children itself are taking, rather than the fats.
Yeah,
And these days, sir, it's like we go for a lipid test, or somebody comes up with a, a total cholesterol of maybe something more than 200. And then, it leads to a panic reaction, and all fats should be stopped. And they go on to, being advised some boiled food or something which is non-compliant, and that leads to craving and even, more issues setting in, and getting on to taking more carbs because you
Yes.
don't get satiated. So
Yeah,
I
yeah.
just want a quick comment on that, sir.
So basically, Vikram, I think, what many of the Gundry and many of the doctors say, that actually doctors are 10 to 20 years behind, what is the latest going on. Let me tell you honestly. So cholesterol actually does not, I will say that, because if you don't take cholesterol, the liver is going to manufacture cholesterol. What people don't understand, your body manufactures cholesterol. So if you used to, so cholesterol is very, very important for the body. And now people have moved beyond cholesterol. They have moved beyond, also low density lipoproteins also, some sort of other categories are important. And they actually, in US, they are special laboratories which actually identify. No, so there is no, don't actually, I think people should not panic about having high cholesterol and, start taking statins, which is a very, drug which is commonly used.
Sir, there is an interesting question from Sister Susie, and in fact, many of us would be thinking also, can diabetics really go for intermittent fasting? Because most of the time, people are in catch-22 situation. They are on oral hypoglycemics. They are struggling with already a drive to keep up their sugars in check. And yes, is it possible? Any insights, sir?
So, so another thing which I will tell you, which I just mentioned but didn't elaborate. When you talk to these experts, we say that I am, like, for example, myself, I am in pre-diabetic. They actually, say that there is nothing called that you are pregnant. You don't say that you are somewhat pregnant.
Right.
So that's what it is. So we pre-diabetic is also diabetic. So my point is this, that intermittent fasting basically under supervision means you should be knowing that, as I said, कि क्या कर सकते हो आप कि एक घंटा बढ़ाएं अपनी, and see that, and if you are on, if you are already on multiple drugs, I will not recommend that. But if you are on a, started and आपका कुछ period ही हुआ है, I think this is high time, because what happens is the sugar is going to create so much of a problem for your body that, our quality of life goes down. My hunt for, this quest actually was this, कि हम लोग मतलब इसका मतलब यहाँ दर्द हो रहा है, वहाँ दर्द हो रहा है, फलाना हो रहा है, problem ये हो रही है. If that is the case with our, health, then there is no point in living. मतलब 60 beyond, you have all sorts of, मतलब मेरे circle में I came to know recently that one guy, had a heart attack at the age of 34. Another had at the age of 44. Now that is very, 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 puzzling. And if you keep tenants, right tenants, and right sort of follow the right path, I think you can take care of your health. And our health, is such that even, for example, 125 years you can live. So there is, and without any problem. So you have to be very clear that what you are eating, very careful that if something you are eating and it is causing harm to you, you should be very clear that, let's try, because there is nobody who will be able to tell you all, ye mat khaiye. There is you will be the only test that, when you take it, it is, for example, I used to take wheat, right? But when I used to look at my feces, I was always worried that, why this feces appears to be, my feces appears to be malabsorption. There's something in the intestine, there is malabsorption going on. So I used to think that there is some problem somewhere. So, I went, some time I went for barley also. Then I got a very severe constipation. So I was asking Dr. Anke Arora that, what is the, percentage of, this gluten sensitivity. He said 5 or 10%, he said. But I said, I don't know. But then when I switched over to sorghum or to bajra, when I started eating, my stools changed drastically. So I could, understand that this is the problem.
So I think,
yeah,
right. Sorry, sir. Sorry to interrupt, but I think it's a very practical insight which you are giving. The body itself tells you. So
Yes,
as a doctor, as a health professional, maybe this is a inherent power which we all have. And if
yes,
we just go with the body, your liking and follow these simple principles, that could be help. Of course, not to undermine, a diabetic must take it under supervision of their
yes, sir.
doctor. I think many doctors are also awakening to the fact of intermittent fasting, and what Dr. Baswal told us regarding the type of carbs, complex carbs, avoiding refined things. Even the medication levels can be brought down initially to go to full-fledged intermittent fasting. Sir, now I'll merge two questions which were again quite interesting by our audience here. One was that many times we read about take olive oil, you take you can say broccoli, all fancy, you could see the vegetable stores and all that being flooded with that. So they want to know really are there no indigenous or Indian, you can say, versions of these barley or sorry, rather your broccoli or for that matter, other cruciferous diet, one. And secondly, how good is pure ghee to take? What are your observations on that?
So let me tell you very frankly that, I am not saying that coconut oil is bad. What I am saying is that, all literature and whatever I have heard and also experimenting on my body, that extra virgin cold compressed extra virgin oil has its own properties, right? And that you cannot, get away with it. Means it is, let me tell you, when you take it, it is amazing. So, what the people do is that, I normally do 2 tablespoons I put in my salad, and 2 tablespoons I take directly. And let me tell you, olive oil is a bitter oil. So it has polyphenols. You are understanding? So, polyphenols are very good for your body and, for your heart also, polyphenols. So, because it's slightly a deviation, but let me tell you a story that how Gundry actually started understanding that what food is doing in our body. So he happened to get one patient who, was sent by somebody and told that Gundry can only, basically do this surgery because he happened to be, very surgeon in great demand. And this fellow was having, multiple blockages. So he came to Gundry and Gundry said that, okay, fine, we will operate you. But, but he was insistent that before operation, please check my, again, this coronary angio. He said, why do I need to go again for a test for coronary angio? And he said, no, I think I am taking something, I will tell you, but you get my, he was very insistent. So Gundry said, okay, let's do the angio. When he did angio, he found out that, the condition was much better to previous angio. So he said, what are you eating? Then he showed that these are the things, and he then started investigating and finds out that these are the things, polyphenols. Like, so let me tell you that, since we are talking about Amla is very good. Excellent, very cheap, very thing. If you can make your, diet, and it has all polyphenols, very good for heart. And any way you can take it.
So I think the message here is loud and clear that olive oil, cold pressed or cold pressed oils are really good. One. Secondly, there could be Indian variants also. For example, cauliflower, your Karela, other green vegetables. You can always substitute rather than going for European alternatives. Besides that, sir, another question regarding cold shower, a very interesting option which you have thrown. And by accident, I happened to watch some of those YouTube videos which are quite in circulation. My only dilemma was that most of these videos are from countries like Europe and Scandinavian countries, and they do have a mechanism of actually going for a real cold shower, or what you call as cold swim. So do Indians need to have a normal cold shower, or what you say, really an ice cold that would be an ideal, or what are your take, and what's your advice to people opting for cold showers?
So what I do is that, even in the maximum winter, I take cold shower, right? Now, what I do is that, your body is going to resist that, right? And tell your brain that it is very cold, you should not take, right? But what I do is that I put my head inside the shower, and, once that shower comes up, so what happens is when you keep doing it, this is an interesting phenomena, because, body has been made why the cold receptors are quite in, good number in our body, because the body wants to protect you from dying from cold, right? Now, when that cold comes in, when you keep on taking for some time, the cold touches on your body, the shower touches, but there is a heat generated immediately from your body. So you don't feel, so you just take it and, you are fine. So I think you must have seen those, but Dr. Sushil, I will say that, we are reverting back to the old times. People, हमारे यहाँ पे सब लोग ठंडे पानी से नहाते थे जब even extreme cold में.
Right.
So that's, the
So I think
Europeans-
there is no need to go for an extra, you can say, shower attachment for a cold shower. You can have normal cold, good old cold bath. I think would suffice. So there was a question regarding how to know insulin resistance in your body.
Insulin, वो एक आप fasting insulin करा लीजिए.
Right.
Fasting कर रहे हैं, उस समय insulin का test करा लीजिए, which is available, and then you can.
So
Also,
I think
also all those people who are pre-diabetic, that means HbA1c में जो आपका आ रहा है 5.7, 5.8, you are and they say you are pre-diabetic, you are all insulin resistant.
So I think a lot of interesting discussions, and I am pretty sure the questions would be many more among this audience, and of course that kicks you all to go and read what Dr. Baswal is saying, and who is the better reader than medical professionals. So I think a wonderful session, sir. You have all got us thinking, and at the same time, I wish that even our younger medical graduates, they also catch up on this new trend, which has been not new, but new for the doctors and health professionals. And sadly, this time we are learning from common people who are not medical professionals, who are coming with best health advice for the doctors. With that, I express my deep gratitude, sir, for a very enlightening session. And right from the person who practices it. So that's more important. I hope everybody is, you can say, motivated. I also thank Dr. Rajesh Mehta, who has been in this session and was has been audience to such deliberations of taking care of your health and taking things in the right way. So with that, I thank all the participants today. I thank Dr. Komal, Dr. Rahul, and Dr. Sonam for organizing this platform so smoothly. I also thank Dr. Vikram, who has been there as a constant inspiration and guidance for all of us to continue these interesting sessions. And sir, thanks a lot, and looking forward for further interactions with you on more interesting topics besides maternal and newborn health. Thank you all, and have a good day. Thanks,
thank
everyone.
you.
Sushil, I think we would like to also thank our participants from Maldives who've been joining on all the community of practice sessions, and they've got enlightened from today's session. I hope they would have enjoyed the session.
Yeah, absolutely. Our Maldives group have been phenomenal. They have been present in all our sessions, and I feel that that's another motivation for all other participants to enjoy this wide, you can say, plethora of interesting topics. And yes, health professionals also owe something to their own health. If we are not healthy, we cannot take care of our patients, we cannot take care of families, and we can't be a good doctor or a nurse. So with that, thank you, sir. Have a good day. And looking forward for more interactions with you in future. Thanks, sir.
Thank you very much.
Thank you so much, sir.
Thank
Bye.
you. Bye-bye.